Hello, everyone, and welcome, and thank you for tuning in to Health Leaders, the place for peer-sourced and solution-focused insights for healthcare executives. My name is G. Hatfield, and I'm the CNO editor for Health Leaders. Today, we are speaking with Chris Young, who is the Chief Nursing Officer at Akron Children's, about the organization's fifth magnet designation. So, hi, Chris, how are you?
I'm doing well, thank you.
Of course, and congratulations, first and foremost, on your fifth magnet designation. That's extremely impressive. So,
Yeah, thank you so much.
congratulations.
I'm really proud to be a part of that.
Of course, absolutely. So to kick us off right at the top, how do you define nursing excellence in 2026?
I think there's a couple ways. So we always want to be grounded in data, right? To demonstrate that our outcomes are excellent and reflective of the nursing excellence that we have at Akron Children's. And I think when we look at patient care quality, patient and family experience, as well as the nurse experience in the workplace, those are three important indicators that really define the excellence in your system. And so that's data, but I also think there's a feeling, there's a culture, there's a camaraderie between your nurses, between their colleagues, their interprofessional colleagues, everyone who works together on the healthcare team. And it's a feeling where you can really sense that collaboration and that joy in work that people find when they're taking care of patients and families and their communities and each other. And I think that is something that is really unique to our health system, is that our culture is very strong and it is very mission driven around the care that we provide each and every day to patients, families, communities, and each other. So those are really what I look at. Some of the other data, I think, when you think about nursing excellence, certainly retention is always at the top of my list, and turnover rates and things like that. And we've really worked hard through our magnet processes, but through other processes as well, to impact nursing turnover and turnover in all of our employees, really. And we've seen some great success in reducing both our overall turnover and our first year turnover. So that's another indicator to me of the health of the work environment that we are creating and supporting for our teams.
Hmm. Absolutely. So, with this designation, what are some of the top sort of issues that Akron Children's is facing and aiming to address?
Yeah, I mentioned it in retention and turnover, but that really leads to engagement, right? The engagement of our teams, how we work together. And so we've been doing a lot of work around how do we foster inclusion, unity, engagement in our teams. And I think some of the things that we are really trying to do is engage people in conversations and connections and relationships. So one of our key strategies around that is to conduct stay interviews with our employees and see and make sure what they're feeling, get what they're hearing, and see where they're headed, right? Seeing about development opportunities, seeing if there's something that's concerning to them that may make them make a choice to leave our organization. We really want to get ahead of that early, and we want to build that trust with them so they feel comfortable telling us, this might not be going right. How do we work together to solve that? So engagement is definitely one of our top priorities. We conduct listening sessions with groups of staff just to make sure we're staying in touch with that front line, because I think that is really the most important element, is
Mhm.
understanding what it's like to deliver care at the bedside or do the job that you need to do to support that care. And I think that's really important and something that we really have to keep as a top issue, in addition to ensuring safe and quality patient care. So, and they go hand in hand, right? So if the staff are trusting you, they are understanding what kind of protocols and practices you're putting into place to make sure that that safety and quality is protected.
Mhm. Absolutely. And so there were a few different sort of initiatives and outcomes that y'all made me aware of before we spoke today. So I wanted to ask you about them. Tell me about the Akron Children's Rising Nurse Leader Academy. What was the
Yeah.
inspiration behind that?
So I am very passionate about nursing leadership. I think nursing leadership has a great potential to have an impact at the macro level about how we provide care to our patients as well as support our staff. So, there is especially during the pandemic, we've seen a decreased interest in nursing leadership. And so the Rising Nurse Leader Academy was really developed to inspire people to want to pursue that path of nursing leadership. So it's been, I think we're on our fourth cohort now of staff nurses. It's for staff nurses who have an interest in leadership. It's actually a 4-year program that allows them to achieve their master's degree in partnership with Kent State University. So we support them financially from that perspective. And then we provide an internal curriculum to teach them all the leadership skills that they want to have in advance of being able to, move up to a leadership position. So as a cohort, they go through a whole year of curriculum, and then they graduate at the end, and then they can complete their master's degree. And so it's really been a successful program. We've seen great interest in the program, and we've seen great outcomes. So we've had a number of participants advance into what we consider formal nursing leadership positions. So it may be a staff nurse going into a clinical coordinator or charge nurse role, or an assistant nurse manager role, or even a manager role. So we've had multiple transitions of participants in that program accept those roles and do very, very well, because they've got some foundational skills already built when they move into those roles. Because I think one of the hardest things to do is go from being a practicing nurse, a clinical nurse, into a leadership role. No one trains you for that. So we have excellent clinicians who need support as they go into that leadership role. So it's been really, really successful, and our partnership with Kent State University has been integral to that.
Mm-hmm. Absolutely. And what are some of those leadership curriculum items that you really want to make sure that those nurses are learning?
Right. So we talk about communication skills. We talk about accountability. We talk about crucial conversations, but we also do things like well-being, taking care of yourself, and how do you take care of others as well, and make sure that other people's well-being is top of mind. So lots of different activities that we incorporate into that curriculum. We use the American Organization for Nursing Leadership Competencies to drive that curriculum. So it's very evidence-based. And so it's really been successful for us.
Absolutely. Yeah, that's fantastic. So something else I wanted to ask you about, what virtual nursing model is Akron Children's using, and have there been
Sure.
any positive outcomes you want to share?
Yeah, we've had great success in our virtual nursing program. So we started our virtual nursing program in 2023 as a pilot on one acute care pediatric unit. And we partner with a vendor, but we have virtual nurses scheduled every day, 12 hours, 9 to 9. The nurses really play a hybrid role. So they're doing a combination of bedside care as well as virtual care. We thought that was one of the guiding principles of our model, is we wanted to keep the virtual nurses still providing direct bedside care on their teams. So it was really a transformation of the model of care versus adding a layer on top of the care model in its current state. And it has really been successful. We have it rolled out to 5 acute care pediatric units now. We are also ready to launch a pilot in our emergency department for triage. So it's been really successful. We've seen improvement in patient experience. We've seen improvement in nurse experience with the program. It's also one unintended consequence is it's really impacted our ability to identify and mitigate safety risks. So when the virtual nurse can be viewing the patient room, if the child is trying to get out of bed, or if they're doing something that puts them at a risk for safety, they see that sometimes because there might not be a nurse in the room. So they can immediately contact the nurse who's at that bedside, and she or he can go in and address those safety concerns. So we've had great success with throughput and education. We do a lot of education virtually, and the nursing staff who are on the unit really feel the support from the virtual nurses. So if they're tied up in another room taking care of a patient, they can call the virtual nurse and say, hey, I'm going to be tied up in this room. Will you keep an eye on my other patients and make sure you round on them and make sure that they have their needs met, and let somebody know if there's something that needs to be done. So we've really been very happy with our program. We're continuing to look at ways to expand, but very successful. So we're looking forward to seeing how we can impact care in the emergency department as well.
Absolutely. So I'm curious, how do the nurses rotate between being virtual and being at the bedside? Are they in like a central location or how does that kind of work?
We have a hub that is on site. So
Okay.
they're still in the hospital where we have the virtual nursing program, and they're scheduled with their teams. So the nurse manager of that unit will schedule them either on the floor or in the virtual nursing hub and balance everything out. So they're still a member of that team. And so they're
Mhm,
really built a trusting relationship, and that credibility was maintained because they're doing both roles.
mhm. Absolutely. And then sort of along the same kind of technological vein, how has Akron Children's invested in AI and where do you sort of see that going in the future?
Yeah, so I think one of the most successful things we've done at Akron Children's is using AI for our provider documentation. That was how it started. But we are expanding that to nursing documentation as well. So the nurses will be able to kind of care out loud
Mhm,
and it will hear them, and it will do the documentation in the electronic health record for them. We are really excited. That pilot will launch in September. So we're doing again 2 of the acute care pediatric units who are already up on virtual nursing, and that was a key point because they're already used to leveraging the technology. They trust the technology because
mhm,
that was one thing, you always have to pay attention to trust and engagement in technology. So we were really able to demonstrate that the virtual nursing program didn't replace the nurses at the bedside, but augmented the care that was being provided. So we are advancing to the AI piece of it in that same environment because we've already kind of developed that trust in technology. So we're really excited to see how much documentation time we can save, because that's what we hear from nurses all the time, is that we want to spend more time at the bedside with our patients, and we
mhm.
spend a lot of time documenting in the computer. So this should help to decrease that, and we'll have outcomes to measure, and we'll track all the data to make sure that we're seeing the outcomes that we want to achieve.
Absolutely. Yeah. And we'll have to circle back and talk about those
Yeah.
outcomes at some point. Yeah. But it sounds like
We'll
all
be
these
doing some
strategies.
we'll be doing some research projects on that. So hopefully we'll have
Absolutely.
those in the literature as well, in addition to the
Yeah.
virtual nursing program.
For sure. Absolutely. And it sounds like all of that is like really working towards what you were talking about at the top of our conversation about achieving nursing excellence. So I
Mhm.
wanted to ask you as my last question, do you have any advice for other CNOs who are also trying to achieve that and maybe earn a magnet designation?
Yeah, I think if I had to sum it up, is connect with the staff who are providing the care, because that is one of the most important elements, is making sure that the nurses and the other team members who are caring for the patients have a voice in how they care for them, whether that's using technology, whether that's staffing models. You can go into many different things, quality improvement efforts. Really hearing that voice from those providing the care is an essential component, as well as supporting the leaders who are supporting those team members. You have to do both. And I think that really drives the successful achievement of recognition such as Magnet.
Mhm. Absolutely. Well, thank you so much, Chris, for your time. I'm really grateful to have had this opportunity to get to know you a little bit and hear your insights, and congratulations again. And thank you so much to our audience for listening. Thank you, Chris.
Thank you. It was a pleasure.